Hello and welcome to my YouTube channel. I am Ulf Pape from Berlin and I have been teaching creative techniques and applications to medical massage and physiotherapists, physicians and osteopaths for more than 20 years. On this channel you can find a variety of free of charge tutorials in different languages. If you like my channel, please subscribe. This particular tutorial is about treatment of the spine. Put one leg on the bench. This allows you to release your power from your body's center of gravity. Start with gentle strokes. Slide your palms over the transverse processes from the thoracic spine to the coccyx. Then stroke out the cervical spine with gentle plucking movements. Do not apply any vertical downwards pressure in this maneuver. Then position your fingers in the foramen magnus over the upper cervical muscles. First, carry out very gently synchronized mobilizations. Then order your patient to minimally incline, recline, rotate, and flex into the resistance of your fingers. Then position your finger berries on the pincer shape on the cervical vertebrae. Order your patients to wriggle their cervical spine into your fingers. In the following sequence, glide your fists over the transverse processes into the myofascial tissue, from the thoracic spine to the sacrum. Melt very slowly into the tissue with this fascia technique. Then slide back down to the level of the first thoracic vertebra. This intensive maneuver is followed by gentle stroking. Use also the back of your hands. In the next sequence, you treat the patient in the Sphinx yoga position. First, place your fingers on the transverse processes of the cervical spine. Tell the patient to move into the resistance of your fingers. The whole spine should now move like a snake. Then apply pressure to the transverse processes of the thoracic and lumbar spine. Move the vertebrae transversely together with the patient's own movement. This maneuver should be performed very slowly. In this application, you also reach the smallest muscles of the spine. Finally, press your fingers into the four holes of the sacrum. I have only hinted the individual whirling techniques here. In the next maneuver, slide your fists paravertebrally and bilaterally from the sacrum to the middle of the thoracic spine. Glide up and back. Again, work only very slowly. Now it's getting crazier and crazier. You stand up and the patient assumes in the quadruped position. You are using the same twirling techniques as before. Now the patient moves like a snake and a cat. This crazy interaction releases more and more very deep tensions and blockages. This increases the desire for complex active movements of the spine. Hands-on techniques become versatile, active movements. You create a synthesis of manual techniques and movements. This relieves pain quickly and sustainably. Your clientele will be delighted with this application. Then the patient moves into the prone position again via the child yoga position. At the end of the sequence, apply the fascia technique that you have already done several times. Don't forget it. Melt slowly into the tissue and use your body's center of gravity. Of course, the treatment continues now. How? You will find out in the next tutorial. So, don't forget to subscribe this channel. You will gradually find new ideas. Thanks for your attention.